what I see oftentimes is people will get a prescription for something like Cialis or Viagra, and they're taking it, but they're not getting results because
Right.
it's kind of like a mind over matter issue at that point, and they don't realize how context can overpower, a physical response. And so even though the medication they think theoretically should be doing its job, the anxiety overwhelms that. So I do see that for some people, and in them, we just have to keep tackling it from a therapeutic perspective. Other times people do find that some medication can be helpful, and it's just enough to get them over the hump and build their confidence back up. Um, and that can be beneficial. Other people find that it helps, but then worry about coming back off it because now they have sort of a psychological dependence on it. But, it's
Right.
one of those things. I think it's an option. There's usually no harm in trying it. But if, let's say, you've been checked out by your doctor and they can't find anything wrong with you and they think it's psychogenic, I would say, let's just try therapy first before we bring a medication in it. If you still feel like you're not making progress, let's try it for a little while and see if it makes a difference.
Now, what about the guy that'll come to you and say, Dr. Jamea, well, I have sexual anxiety. Shouldn't you put me on anxiety medication to take care of it?
Oh, I wish it were that easy because, as you know, so many of the medications that are prescribed for things like anxiety or depression have sexual side effects.
Right.
And so it's like, oh, it's such a double-edged sword. The biggest, probably one of the most common class of medications that people are put on is a class called SSRIs. These are things like Zoloft, Prozac, Lexapro, and they're great at helping, anxiety, but oftentimes they can make it hard to have an orgasm. They can, put a dent in libido a little bit. Some people find that taking something just in the moment, like a very small dose of Xanax, can help take the edge off, but that's a muscle relaxer, and
Right.
muscle tonicity is usually important during a sexual experience. And so sometimes you have to work with your doctor on finding just the right dose or combination of medications that can help with the anxiety. But unfortunately, a lot of them do have sexual side effects, some more
Yeah.
so than others. But